I now think of the ecological determinants of health, things like soil, water, energy, as the necessary underpinning for our social structures, our financial structures, and those, of course, give rise to the social and structural determinants of health.
Climate change impacts mental health in a couple of ways. The first is anxiety over climate change itself, and the second is a result of climate change impacts, such as weather-related natural disasters.
It distinguishes them into three. It talks about acute events such as hurricanes, floods, wildfires, subacute or long-term changes such as droughts, heat stress, and also existential threat of long-lasting changes, including higher temperatures, rising sea levels, etc.
Natural disasters are a source of stress and anxiety. When threatened by floods or wildfires, people will naturally be wondering, will I have to evacuate? Where will I go? Will my house still be here when I come back? And the reality is that sometimes it won't be there, or it'll be damaged beyond repair. People or their loved ones might be injured, may become sick, not be able to access healthcare for existing conditions, or they may lose loved ones. These losses of people, physical health, place, belongings, memories can adversely impact mental health, from depression through to PTSD.
Our ecosystem is our health system, and we need to be putting as much focus, effort, and human resource push into this area, because this is really what has, for generations upon generations, kept us well. Nature is generally declining less rapidly in Indigenous peoples' lands than in other lands, and that governance, including customary institutions and management systems and co-management regimes that involve Indigenous peoples and local communities, can be an effective way to safeguard nature.
When you're talking about the SDGs, it's not a new thing to teach people about. It's actually a universal language that we should recognize comes from the complexity of the lives of people who have faced complex situations and trauma. That there is strong experience on compound trauma, collective trauma, on compound disaster and the effects of disasters. So what I'm looking at is the positive outlook from the fact that that knowledge exists.
We have to redefine what data and evidence are, because qualitative data are still data. And yes, they're stories, but they're data. And we need mixed methods approaches. We need traditional knowledge. We need traditional ecological knowledge. We need the qualitative and quantitative, and we need to value these.
We know the least about the locations that are experiencing the biggest climate change impacts. And so there's huge content gaps in terms of health outcomes. And there's also huge content gaps in terms of futures. What adaptation strategies are most effective for who, in what context, that it's really important to be making evidence-based decisions in the health sector.
The collaborative approach that integrates and articulates health consideration into policymaking across sectors. And this is all to improve health in all communities and people. The health in all policies approach may be effective in identifying gaps in evidence, so where we can finance the research, and achieving health equity.
Indigenous knowledges around the world are natural systems thinkers. And when we think about systems, it's really about irreducible wholeness. So relational systems thinking really looks at irreducible wholeness. It looks at feedback loops. We use tools like systems mapping, sensing into systems, sense making, planting the seeds for systemic transformation. If we continue to develop policies that don't shift and address the mental models that got us into this predicament in the first place, then we're not really addressing, I think, some of the fundamental issues that are causing climate change.
So stakeholders can be found in every level of society, right from the global, regional, national, subnational, city. It does appear that in Canada anyway, and at the municipal level too, is where action really needs to take place, and where communities and neighborhoods can then become involved, as well as families and individuals.
If we keep climate change to scientists on climate and public health to public health, which obviously we're not doing, there's all the environmental determinants, but we would be limiting ourselves.
They are bringing this conversation to the table, and they're making climate change not just an election issue, which it has become since they've started doing this, but they've made it an everyday issue, and they're holding people accountable to it. Things that the youth are asking us to do is listen to the science. And so they're really basing a lot of their calls to action on science.
Because they're going to do better than we did, and they are convinced, and I think it's the next generation. And the other one is that when there is an emergency, people get together and act. The only thing I hope is that we won't wait too late for that emergency.
I'm not a person who believes in a technological answer, because it won't come, I don't think. But I do think, though, that we will be aided by better technologies in the very near future.
Asking our ancestors to help us is a huge part of this, and it gives me a lot of hope that more and more people are committing to learning about their ancestry from all over the world, because we're all Indigenous to Mother Earth.
And the fact that we can have panels like this and dialogues like this, and it's also the engagement of civil society in COP and places like that. So it's the grassroots. That's what gives me hope.
I'm seeing that power in numbers. I'm seeing the strategy in a way we've never, ever had before. And I think we're going to see tremendous change in the next few years.
The most hopeful right now is the legislative opportunity we have in this country. BC we have law that says we have to align all our legislation with the United Nations Declaration on the Rights of Indigenous Peoples, with front and centers, which says relationships spiritually, mentally, emotionally, and physically with our environment need to be protected.
I think my hope stems from the fact that in Canada, the mass media has now made colonization, decolonization, and recognition of abuses a conversation that is massive.
It's just about community supporting each other. So I think it would be useful for this message really to go to communities that are going through a tragedy, going through kind of climate change impact events, so that at least they know that they need to support each other. Similarly, people who live in different places but have family members or friends in communities that have been impacted should rally around and provide that level of support.